of the vision to see beyond the conventional, an acuity of observation, a willingness to challenge accepted notions, the tenacity to keep going, and exceptional technical engineering and surgical skills. By common consensus, Derek McMinn is the world's most famous hip surgeon. Perhaps the greatest compliment to him that I heard was from another orthopaedic surgeon. If I need my hip replacing, I want a Birmingham resurfacing, and I want Derek McMinn to do it, no matter what it costs me. Vice-Chancellor, to you and to the University, I present Derek James Wallace McMinn, deemed worthy of admission to the degree of Doctor of Medicine, honoris causa.
By virtue of my authority as Vice-Chancellor, it's with great pleasure that I confer upon you the degree of Doctor of Medicine, honoris causa. Congratulations and many thanks for accepting. Thank you.
Deputy Pro-Chancellor, Vice-Chancellor, ladies and gentlemen, proud parents, and most of all, graduates of 2009. It gives me enormous pleasure to accept this honorary MD from Birmingham University. The medical graduates amongst you will have spotted different characteristics in the consultants from the various specialties of medicine. The physicianly types admit interesting patients to hospital and do investigations. The general idea here is to keep the patient amused while nature takes its course. We orthopedic surgeons are much more practical souls. We don't waste money doing tests. We look, we feel, we move, and then we perform a hip replacement. That operation has made orthopedics the biggest single medical specialty in many countries, including the United States, not quite yet in the United Kingdom, where there is still gross underprovision. The definition of an orthopedic surgeon is someone who you put in a room with two ball bearings and he loses one and breaks the other. On this day, my colleague Ronan Tracy, another orthopedic surgeon, as you've heard, and I both receive honorary MDs. So what, I hear you say? Well, so far as we know, we're the first orthopedic surgeons to ever get honorary MDs from Birmingham University. Now, it is true that Ronan and I developed a bigger and better ball bearing called the Birmingham hip. Maybe that brought us to the attention of university, but I suspect there's more to it than that. Orthopedic hospitals in the past were populated by patients with polio, tuberculosis, and other infections, by the victims of trauma, children run over in the street by the horse and carriages of the passing rich, victims of war, and the new plague of industrial accidents, very prevalent, of course, here in the West Midlands. So orthopedic surgeons treated the poor, the working man, and the disadvantaged. The orthopedic hospitals in Birmingham were the Cripples Hospital, which then became the Royal Cripples Hospital, which then became the Royal Orthopaedic Hospital. Can you imagine the distress of a parent when your child was admitted to the Royal Cripples Hospital? Not good. Treatment was palliative, with splints and braces, and the economic status of the family was further dragged down by having to look after a permanently crippled child. No glory, no glamour, no MDs for the attending surgeons. Sir Robert Jones, the father of modern orthopaedics, trained an elite group of orthopaedic surgeons to deal with the massive numbers of trauma victims returning from the trenches of the First World War. A Mr. Norton Dunn was sent to Birmingham. The injured soldiers in Birmingham were being treated by the gentlemen surgeons of central Birmingham. In the spare time between their hospital practice and their private consulting rooms, the war victims were treated. Do remember that this was pre-National Health Service. The treatment for the injured soldiers was appalling. Norton Dunn gave the surgeons the choice of retraining in modern trauma care or clearing off. To a man, and they all were men, they abandoned trauma and orthopedics to Norton Dunn. From that day, there has been a rift between orthopedics and the University of Birmingham. Birmingham is the only major city in the world that does not have a professor of orthopedic surgery. Not my fault, not your fault, sirs, not the fault of anyone here, an accident of history. Surely it is now time to forget the events of the First World War and move forward. Orthopedic disease has changed, thank God. Salk's vaccine and streptomycin saw off polio and TB. These were the major diseases, of course, that led to the admission to the Cripples Hospital. With a healthier population living longer, osteoarthritis of the major weight-bearing joints of the hip and knee became an increasing problem. In 1962, the late great Professor Sir John Charnley from Manchester perfected the operation of total hip replacement. That operation relieved the suffering of millions of patients throughout the world and sparked the development of replacement for nearly every joint in the body. Osteoarthritis of the hip in young patients has become a major problem, unfortunately. Our development of the Birmingham hip was specifically for the young, active patient. The mean age of my patients is 53, and my youngest patient is aged 13. I explained that orthopedic disease of yesteryear affected predominantly the poor. Osteoarthritis is no respecter of economic status. It affects both rich and poor. Without wishing to sound like Fidel Castro without the beard, I suggest that the treatment of rich patients brings more kudos and perhaps more MDs. For many years, orthopedics has attracted graduates who wish to earn a shed load of money. However, there are more profound reasons why I would recommend the specialty of orthopedics to you. It is enormously rewarding to see a patient hobble into hospital with years of increasing pain and disability from their hip or knee arthritis, and then 4 or 5 days from their hip or knee, they walk out totally free from pain, ready to start a new phase of their life. In my field of joint replacement, there is tremendous growth, both in volume and also by the introduction of new technology. As orthopedic surgeons, our closest allies are the fields of anesthesiology, dental surgery, and engineering. Anesthesia has improved dramatically over even the past 10 years. Our patients are fully awake 10 minutes after surgery has been completed, and they are entirely free of pain. Our blood transfusion rate after hip replacement is now 1.4%. 20 years ago, every patient had 3 or 4 pints of blood. Our deep vein thrombosis rate, with a multimodal regime, including reduction of systemic fat embolization, is now lower than any study involving anticoagulant drugs. Anesthesiology is another field I can commend to you. For years, orthopedic surgeons have borrowed techniques from dental surgeons